Alrighty, it is 12 o'clock, so I am going to go ahead and kick us off here. I'll do a little intro, which will give everybody just a couple more minutes to come in and join us this afternoon. So welcome, everyone. Thank you for taking the time to join us for today's webinar hosted by North Carolina Medical Society Foundation and the North Carolina Medical Group Management Association. My name is Danielle Snyder, and I am with North Carolina Medical Society Foundation. We are thrilled to have you all joining us this afternoon. The MGMA's mission is to maximize the value and effectiveness of medical practice leaders throughout educational programs, information exchange, networking, and professional development opportunities. NCMS's mission is to provide leadership in medicine by uniting, serving, and representing physicians and their healthcare teams to enhance the health of North Carolinians. We have enjoyed our collaborations with these monthly Lunch and Learn webinars we produce for our membership, and in each of our shared educational opportunities, we try to embody these two missions, and this virtual meeting is no exception. So today's presentation will be focusing on recovering and building financial resiliency in the wake of COVID. We will be hearing from two great speakers as they review the financial lessons learned through the pandemic and how building financial resiliency is key to practice stability. They'll be discussing the practical aspects of recovering from the costly impacts of COVID, what is being done to build up practice resiliency for a stronger and more stable future. Throughout the presentation, you can submit your questions in the chat box. We will keep that monitored. We do plan to have time at the end of the presentation to answer your questions. We are recording this presentation, and a copy will be made available to you after today's session and posted on our page. So without further ado, I would like to introduce you to our speakers today. We have the wonderful Dr. Karen Smith, medical business owner, and Michaela Latham, her practice population health administrator. Karen Smith is a graduate of Hannah University School of Medicine. She trained at National Congress of Family Physician Residents, North Carolina Academy of Physicians, Duke University, Cape Fear Valley Medical Center, and fellow American Academy of Family Physicians. Dr. Smith has been practicing since 1992 with a private practice in Rayford, North Carolina since 2003. Dr. Smith's practice specializes in family medicine. Michaela Latham currently serves as the Population Health Administrator for Karen Smith, MD-PA. In addition to managing and coordinating quality improvement initiatives and projects for Dr. Smith's practice, Michaela also manages the Chronic Care Management Program and serves the practice as part of the leadership and management team. Michaela attended East Carolina University, where she received her Bachelor in Science in Public Health Studies with a concentration in pre-health professions. Following the completion of her undergrad studies, Michaela earned her Master of Public Health from the University of North Carolina at Charlotte. Michaela has worked collaboratively with the team at Karen L. Smith, MD-PA, and the patient population they serve since 2017. Michaela and Dr. Smith, thank you both for taking the time to be here with us today, and I will turn it over to you.
Thank you so much. It is truly a honor to be asked to share the office experience and what our practice has done in light of COVID. And as I was thinking about how can I present this to a group of folks who really know what they're doing already, and I started playing with my cell phone, and I realized I had all of these pictures that started literally from day one of the pandemic. And so what I'm going to do with you today is to share my experience through the pictures and what we were seeing. But before we start off with our slides, I wanted to make sure that I introduce you to Michaela Latham, who's my colleague and daughter, and here in the office working with us since she completed her master's in public health, and she's going to chime in. Now, Michaela's job today is to keep me real, and I'm sure she will do it. She does a good job at it. And so I want you to hear the reality as I kind of talk about the dreams and what we could do to make sure that we continue to move through the pandemic and get to better days. When we talk about resiliency, what is that? The ability to understand or recover quickly from a difficult condition. And it's that quickly word that I have a problem with because this pandemic is not quick. Resilience, when we look at just the 7 skills of resilience, and the first one was starting off, seek meaning. What is it that we're trying? What is this all about? Cultivate an attitude of survivorship, activate positive emotion, and be helpful to others. Talk about, what are you going through? And to communicate that. Stay connected with sources of support. Who's helping you? And what are the hidden support efforts that maybe you didn't realize were there? And cultivate a belief in your ability to cope. And those are the 7 skills that I'm hoping that we can review through this pictorial history of what our practice has gone through. The other thing I want to throw out is we use a lot of tools, and one of my favorite ones is one that most of you are familiar with, the SWOT analysis. What are your strengths? What are your weaknesses, your opportunities, and your threats? Kind of keep that in mind as we move along. I'm going to go ahead to the first slide. And so the goals and objectives is just as we said, review our practice experience, and then just kind of discuss the timeline of events and opportunities to share your experience and what are some best practice solutions. And I'll even say on that note, the best solution is the one that you have created for your environment. That is the best solution. Next slide. And so awareness of COVID-19 pandemic. And I love this rose that we have displayed here because it's the colors of a country where we were when the pandemic was declared. Next slide. We had started a mission trip and we had to make the decision, were we going to go to Jamaica or were we going to remain in the United States on March the 10th? And we had planned so hard. And we actually started off with the medical mission conference that's held at Lakewood Church. And we went out and we prepared. We were ready to do our very first mission trip. And we had this passion, this heartfelt desire to do something for people other than ourselves. And so there's a beautiful hotel, the host who had us to stay. And then this was the church up in the mountains of Negril, where we ultimately did get there. Next slide. And this was our team. We have Father Collins and my husband, Michael, behind me. And and Judy in our office. We have the Smiths. So we have a whole team who have worked together for this trip. Now, I could tell you nobody's sweating, but we had attended the church service the Sunday after arriving in Jamaica, and there was a lot going on. Next slide. We did make it over to Bob Marley, and this was an important slide for us. Even though we're smiling and we're pointing our fingers up in the air at Bob Marley showing one love and looking at the beautiful mountainside of Jamaica, I can tell you there was a lot going on in Kingston on March the 11th. But we knew that if we could put our strength together along with our hosts, that we were going to make it through that trip. Next slide. And here's why we were there. There were children who were in need of health care. This little fella had the best smile. I said, I'm going to put this smile everywhere I see it. And we were driving to Negril, and we were between Negril and Kingston, looking at the beauty of Jamaica. But at what was happening, they, like the rest of the world, heard about COVID, and they were fearful. But this little fella, he continued to smile, even though the parents were running around and were quite apprehensive, but he was continuing to show his joy. Next slide. And so that was the awareness. This is real, guys. COVID was real. And the World Health Organization decided, the nations, the countries had to come together for a global response. But that awareness did not necessarily bring on understanding. What is it? What are we doing? And what is the impact? Well, we traveled on to Kingston. And if we go to the next slide, we'll see that we met with the family medicine department folks. And it was interesting because they wanted to cancel our visit, but they asked us to come. Well, we walked right into what they had already determined was a containment zone. So Jamaica had already received the World Health Organization test kits, and they were already testing people for COVID. And they already identified positive cases. And when a case was identified positive, they created a containment zone. And that's where we were. We were at the medical center on the University of West Indies, and they had noted that there were people there who were positive. Therefore, no one else could come in nor leave for 14 days. We kind of snuck out the back way. We came in through the back and we left through the back. But the good thing about it was the opportunity to see another country putting forth their efforts based on efforts from other countries. And it was China. And it was China who had supplied them with the kits. It was China who had actually funded a lot of the services at the university. And as a political issue, because China has also acquired much of the land in Jamaica in return for what they have provided. Very political, whatever it was. But when we seek meaning, one of the things that I learned was there was this high value placed on life. Bob Marley's One Love, looking at the children, working with Father Collins in the mission work, there was a value placed on life. I didn't hear so much about money, but I heard a lot about life. And that kind of said to me, when I get back to America, we've got to start our strategies based on people and who they are and making sure that we're keeping folks comfortable while we have awareness, but we don't have a lot of understanding. Not on March 13th of 2020. Next slide. And that's where we were, a lot of anxiety. It was a lot going on. I didn't talk about the slide of Mr. Hendricks kind of walking towards the truck there. He was ready to go because we didn't know if we could get back into America. And we did. We came in through Baltimore. While on the news, we were looking at people scampering and scattering, trying to come in through New York and New Jersey because they didn't know if they could get back into America. Could they get back into the country that had all the answers, that everybody was trying to get here and start something? And what was going to happen to us as individuals? And what was going to happen to our businesses? And what were we going to do? So that slide that we're looking at, really, that was going on. But remember, we started off with resilience and we talked about SWAT. We had to put it to play. Next slide. And that's it. I actually put the plane ticket up for Southwest Airlines to show you March 13th. We got a ticket back into the United States. And you talk about happy touching the soil, we were. But then we knew what was happening in our own country, what efforts. Well, we didn't have the WHO kits that we were using in Jamaica because remember, America had rejected and were concerned about the validity. So therefore, we had people who had COVID who were testing positive, but yet we didn't have confidence in our test kits. And so we had a little delay. And it was just interesting listening to how other countries addressed it and how we were addressing it. We didn't have containment zones, but Jamaica did. We had areas of isolation, but we really were not able to contain the virus as well as some of the other countries. Again, a lot of politics, a lot of dynamics, whatever, but we, as a practice, we had to deal with that. Next slide. And that's what we have. I realized this wasn't the best. We talked about this novel coronavirus, and we were trying to take screenshots of CNN every morning, and that's what we had. February, that's when the virus is supposedly first noted or was first noted, and what was going on. But at that time, we didn't have all of the numbers that they showed every single day to this day of how many people were getting the virus and who was dying and what was going on. but what about the business of Karen L. Smith, MD, PA? Well, our team was so wonderful. And I don't know if you could see in the window where they put up, "We are here." As a business, we had to reassure our patients in the community, we are here. You don't have to go away from us. You don't have to fear us. We are here. And the team showed wearing masks and social distancing. How do you do that? But we are here. Next slide. And then the coronavirus. Well, if you look at the date on this slide, Saturday, April the 25th, I think all of us were into Zoom at that point. But finally, the National Academy of Medicine, of Science, is a trusted source. And I'll be honest with you, if you can go back and look at that lecture, it is the best lecture that I had ever attended that actually said, what was coronavirus? What was COVID-19? And what impact was it going to have on us physically? And again, we took on the idea of people, of persons, of life. Yes, the business had to withstand, but life was over the business, the money part of it. And that was the attitude that our practice took on. Remember, I spoke about survivorship in terms of resilience. And that was one of the strengths that we were using. I put the timeline up in terms of COVID. And again, it's not the best slide, but if you want to go through, you can pull that. Next slide. Okay, we have an idea, we have a plan, we have an action, because we need to sustain this practice. And we need to make sure that people will come to us, that they will trust us, and that we have put forth what was necessary to make people safe and feel safe. And so we started with some of our activities. I'm going to stop for a second, and Michaela can kind of tell you, what did we do initially in terms of how do we make people feel safe and the staff feel safe?
Yeah, so I'm going to comment on that. So I would say that we started preparing as soon as in our state, Governor Cooper announced the first initial lockdown, which was back in March or late February, I believe. And so fortunately for us, we had some workflows and protocols in place that allowed for immediate connectivity when it came to the telehealth visits. And so with that, we were able to give an immediate alternative to our patients so that we were able to maintain that patient volume and that connection to our patients during the initial wave of the pandemic, because there was a lot of uncertainty. We didn't have a lot of information. And as we know, there are added things, symptoms, precautionary guidelines every other day. And so we were using what we had received and what the nation had received at that time. So also using that initial data, we were able to devise our plan, our COVID protocol, if you will. It's about a 2-page document where we kind of just put together what we wanted our workflow to look like in order to secure our patients, but also secure our employees so that we could maintain operation. So we came up with cleaning protocols, telehealth protocols, protocols for maintaining social distancing, protocols for ensuring limited exposure, protocols for any type of procedure that we had to do in the office that may require an extended amount of time being in the room with the patient. So we try to really think about all the different points that we could provide some sort of protection, but also maintaining our operation, maintaining the patient volume, and also giving people peace of mind, because there was a lot of uncertainty. And so I think having some of those initial things already in place. So we were working collaboratively with the OBOT program, and that was for our MAT patients. That was a platform that was widely using telehealth already. They assisted us with taking that platform and transitioning it so that we could use it for our regular patients who weren't a part of the MAT program, and we took care of for regular preventative care, PCP care. And so with their assistance, this is a stakeholder, potential resource that we didn't even think of would be a great resource in the eye of the pandemic. They ended up being one of the entities that made transitioning so much smoother. And then I think the other thing that really played a part in it was how quickly the insurance companies were to make that change to take on that telehealth platform and covering those types of visits. We know that since the beginning of that lockdown, that's changed significantly. They have other, protocols and procedures that you have to meet in order to satisfy what they're willing to cover as a telehealth visit. But just the initial support and implementation made, like I said, transitioning very early on successful for our practice personally. And I don't want to overstep Dr. Smith, so I think that's what you asked me to cover. If you want me to step on anything else, let me know.
Oh, I'll bring you back in. Okay, next slide. And so what Michaela has outlined exactly that. So as soon as we hit the soil of the United States, we put in our application for the SBA loan. That was a interesting task. And Michaela actually was the one to kind of go through and put that in. And I could tell you, we worked really hard on it. And we'll talk more about what happened. And then, again, we spoke about in terms of resilience, staying connected with sources of support. Well, here we have Mike Nagowski with Cape Fear Valley Health Center. He just walked in the door and provided us with supplies. All I had was some goggles, one gown, gloves. We did not have proper PPE. And that was support. The North Carolina Medical Society, they provided us with PPE. And then our federal government released the payroll protection plan. And so the PPP money became available. But the applications for these was something new, was different. The practice had never done these things before. And so we did receive assistance from our ACO, and they too sent more PPE and sent assistance. And so again, when we talk about being resilient, our friends, our colleagues, the relationships that we have built over the course of many years, they came and they helped our little independent solo practice. They didn't forget where we were. And I say this because I acknowledge it and say thank you if I haven't to all of those individuals. And so that's part of being resilient. The SBA Disaster Loan, we put our application in and we were promptly denied. A whole lot behind that. But I'm going to talk about what happened because we had to stay connected to some unexpected resources. Next slide. Well, while we were going through all of this, all of us witnessed on the television a horrific death that occurred. George Floyd and how he died. Well, George Floyd's family is from Rayford. And so this community felt the sorrow and the pain in terms of what happened to their family member. And then I also show the picture of what happened to our country. So that unanticipated loss of life, that wasn't coronavirus. That was loss of life that should have never happened, but unfortunately was a reflection of racism and discrimination that is occurring throughout the United States. And so on top of COVID, we now deal with this issue, which has always been here. And if you go to the next slide, acknowledgement of a country. The United States of America acknowledged that there were disparities going on. And we saw that with the loss of life with COVID. And we saw all of the issues that had been occurring. And so we had two issues going on. And I also want to say that we still were dealing with the opioid epidemic. Unfortunately, I heard a horrible loss of life on yesterday of someone who died at home in front of their children because of drug overdose. That epidemic didn't go away. So all of this as a business, we had to recognize that it would have impact on how we deliver care and how we were to maintain our resilience through changing times. Life had changed. Next slide. And that's what we were looking for. So we had denial of the SBA loan. What were we anticipating? One, we knew we could not close our doors. And I spoke to some colleagues and they closed their doors. The fear of COVID was enough to close your doors. We couldn't do that because we knew if we shut down, we would lose revenue. We did not see the SBA money coming in because we were denied. And so we had to go to the drawing board. And what we see demonstrated here is the affinity. And affinity basically is everybody gets their idea and puts your Post-its up and then organize them and reorganize them and putting together. There's a word for it. It's called an affinity process. I just thought you put Post-its on the door. But anyway, that's what we did. We had to put our ideas back together and how were we going to sustain the business? Next slide. Unexpected resource. Out of the blue, I was called and asked, can you please attend the funeral of George Floyd in Brayford as one of our leaders? And I said, okay, I didn't know I was a leader, but I'll be more than happy to go. And there were two who showed up, G.K. Butterfield and Representative Hudson, both spoke at the funeral. And it was amazing because Representative Hudson became an unexpected resource. The very next day, on that Monday, I sent a letter to his office and I called and I bugged them and emailed and everything else other than sending up smoke signals to DC. And I said, guys, we were denied the SBA loan and I don't understand why. We need help. 2 days later, I get a call back from his office. And the next thing I know, we were on the priority list. And the next thing I know, we had the SBA loan. I don't know what happened. I know a lot of prayers went up, but again, unexpected resources. Keep your eyes open and don't diminish anything because it actually might prove to be in your favor. Next slide. So we had to analyze in terms of what are we doing? And in our office, we do the PDSA constantly. Michaela introduced the PDSA this morning. But I still have to because she wants to change all the dynamics of the practice. But you know what? Plan, do, study, act. We plan it, we do it, we study it, we act. And if it doesn't work, we will it around. We will it around. Because trying to solve a problem or part of resiliency is actually putting forth solutions. And it has to be a team effort. It's not always throwing money at a problem that's going to solve the issue. So we analyze. And I love this picture because we're sitting here looking out on the horizon, trying to figure out where do we go and have our efforts actually fulfill the needs of the practice from, again, people, from the patient standpoint, from our team standpoint, and from the business part of it. Where are we? And the problem that we're having with COVID right now is it's hard to predict beyond December 31 of 2021 because we're just not quite sure. Next slide. So here we are, beginning of a new day. We have an election that occurs. We have a whole new administration in place, a whole new thoughts and ideas that are coming in, and then the vaccine. And that's where we are right now. The practice is actively working on being one of the independent practices to actually administer vaccine. But the leader of the practice got to get it first. So Old Dark 30, we went over to Cape Fear Valley and we received the COVID vaccine in December, and the second one is done. And now we've had the entire staff has received the vaccine, and we are ready to roll it out to people in our community. The business part of it, for our independent practice, it was remaining viable, remaining available. And we started off with a sense of people. The next slide. Well, we started off with people, but there's Leo, my Huskadoodle, looking out, ready to go for whatever. I don't know what he's looking at, but you know, I love this picture because he's looking out beyond his boundaries. What can he do? And I think that's part of being resilient, is recognizing that we have so much And if we just look beyond our boundaries and not get so wrapped up in terms of the way life used to be or the way we used to do things, if we had become wrapped up in that, we would not have adopted telehealth or telephonic. And we also had to make sure that we advocated to our payers. Hey, people like this, pay for it, and let it be part of our repertoire of services that's in the office. And so all of these, it taught us a lot. We went through all of the different strategies. We've done the fishbone analysis, and I'm going to throw that out as another strategy for practices. If you haven't done it with your team, use that analysis, and all of these you can certainly look up. We already talked about the affinity, and then the one that the spaghetti diagram. That's probably the one that we need to use right now. How do you start off with an event and kind of line it through, and where's it going to end, and how do you put it all together, recognizing the complexity of what we are dealing with? And the funding we found came in multiple different areas that were unexpected. The last source of funding came in from North Carolina Medical Society through our state legislators, with granting $25 million into our private practices, because our state legislators recognize that healthcare is a business that needs to survive, just like education and all of our other businesses, and people need to be comfortable. And so these resources are coming in. We know that the second round of the PPP has come in, but you do have to show a 25% decline between any quarter of 2020 and 2021. And for some groups, that's not an easy deal. I'm going to also say, recognizing the administrative burden did not go away. And we saw that with the SBA loan applications, that burden didn't go away. And I hope those lessons learned for our folks who are in leadership pay attention to what's happening on the ground level as all these rules are being put in place. Are the rules so great that the people, that the practices, that the businesses really can't make use of it because it's so overwhelming? And then I'm going to go ahead and mention one other thing, a new term that I learned about. It's called compassion fatigue. And I thought that was really interesting, because we knew that physicians and our healthcare providers, our PAs, our mid-levels, our nurses were dealing with burnout. Even our medical students have burnout. But I had never heard of compassion fatigue. And I opened up one of my first slide was passion. And I don't think we've lost the passion. I don't think we've lost our zeal and love of medicine, but I think the compassion, hearing the horrible death of the patient yesterday and that drug overdose, that's what we're talking about. How many more stories are we going to hear? How many more hands are we can't hold them, we have to pat their back. But, at what point do we lose that? And that's where resilience kicks in. That's where we recognize our comrades, our colleagues. That's what resilience is all about. I don't anticipate having to deal with compassion fatigue, but I do want to recognize it. And so those of you who are practice managers, I'm giving you the story from just a point of perspective of a physician, but I recognize that you have the role of working with doctors and with your teams. And I just encourage you and throw out that strength, the SWOT analysis of what we can do to assist. And I think if we all come together and we add a little bit of know-how to it, we're all going to get through this. I'm going to just kind of hold here, ask if Michaela wants to share the reality, and then we can just open it up to questions from all of the folks who are on the call today.
Yeah, I just want to emphasize that we're not able to give the perspective of a practice that, closed down for a month and was able to reevaluate, see what would work better, see what was coming down the pipeline as far as where the nation as a whole was moving, because that's not how we transitioned throughout the pandemic. As I mentioned before, we immediately started incorporating other workflows to ensure that we were able to maintain. So we're giving you maintaining what we did to maintain versus a bouncing back narrative, because we just didn't have that experience. Not to say that we didn't lose patient volume, because there were points where we did. Like I said, there was a lot of uncertainty. A lot of patients weren't comfortable with doing telehealth visits. There was a lot of mistrust and distrust. So we did have to deal with that, educating our community, educating our patients, making them feel secure and where we were moving as far as the pandemic was concerned. And so we did face shortcomings when trying to implement all of these things. And so I'm not saying I don't think that we're trying to paint the picture that everything was perfect as we tried to maintain operations, maintain patient volume and connection. But we did come up with strategies in that moment that helped us to get to where we are now, which is a much more stable place. And so I do believe that we didn't go into it with the mindset that we were ever going to close our doors, because we didn't. But we more so went into it with the mindset of what do we need to do to change in order to ensure that we're successful and that we're able to get through this pandemic while still being able to help in our community and help with our patients. And so, like Dr. Smith emphasized, we went into it very much so with, we want to maintain the people, we want to put the people first. But at the end of the day, we are a business, and we have to make sure that we're able to operate efficiently to make sure that we're able to provide that care. And like I said, I just can't emphasize enough how much the stakeholders that were put in place at the beginning of the pandemic made a difference in our success, and made a difference in what we were able to do and incorporate in such short notice. And so I think that if eventually we'll face another pandemic, hopefully it's far, far away from COVID after we overcome this. But I think it gave our practice a really good learning opportunity where we know how to move forward. And hopefully think sessions like this give us the opportunity to bounce ideas and really see what we can implement moving forward and what actually works in different communities.
Very good. I appreciate that. We have another slide that's going to list out some of the resources that North Carolina Medical Society made available. I can tell you, as a member of the board, we have certainly stayed tuned. We have stayed grounded with all of the practices and all of the physicians throughout the state, and has maintained excellent communication with our legislators. And so the best way of doing this is to make sure that you as practices are communicating any issues that you're having. Can't do things if we don't know about it, and encourage you to communicate with our representatives, each of your regional representatives with the North Carolina Medical Society, and as well as the North Carolina Academy of Family Physician. And I can go down the list of the 21 constituency groups that we have as part of Medical Society, but I encourage the managers as well as the providers of care remain connected with your society so that they could recognize what's going on. Right now, we all are working very hard in terms of vaccinating the entire North Carolina population and not leaving anyone out. The disparities that we saw with the loss of life with coronavirus already, we really don't want to duplicate that with the vaccine. And unfortunately, it's already happening, but we want to get hold of it now so that we can get everyone vaccinated. I will go ahead and just open up for discussion, because again, as part of those 7 ideas of resiliency is hearing from others. And so we want to hear, what was your impact, and maybe you have a solution that some of us can use and make use of. So if we can go ahead and open up our communications, and let's hear what other folks are dealing with.
Yes, absolutely. Thank you both for all of that great information. The page that you see on the screen currently, I did put the link in the chat box so that you are able to access that as well. If anyone does have any questions, please feel free to come on video, unmute yourself. You can absolutely use the chat box as well. As Dr. Smith said, we would love to hear from you. If you have any questions in particular, or you have figured out something that worked really well and want to share that information as well. So if anyone does have any questions, please feel free to go ahead and come up on video or unmute yourself or both. We would love to see you if you're open for that.
And I would love to hear maybe experience of another practice in terms of, where were you and where are you now? And I'm really encouraging dialogue, because this is a wonderful opportunity to speak with the folks who are managing the businesses. What are you feeling? Where were you and where are you now?
It looks like we have one comment in the chat. Thank you, Dr. Smith, for sharing your experience and your commitment of your staff during the pandemic and always.
Okay. Thank you for allowing us to come.
Let's see. Don't have anybody feeling brave this afternoon. Come on.
I'm just curious, did anybody else kind of run into the SBA issue as our practice encountered, and what did you do? How were you able to solve that issue if anyone ran into that problem? Or if somebody sailed through it without any kinks, hey, what did you do? Because we have the second round that we're all going through right now. For the PPP, actually. Mm-hmm.
While we are waiting for someone to pop up and speak, I do have a question. What do you think would be your biggest takeaway from the last few months, this whole experience that we've all gone through, in regards to making sure that you're better prepared in the future? What would be your biggest takeaway, you think?
I think from the business side of it, making sure that our accountants had all of the data that was necessary. So one of the applications did require profit and loss. And so some of us do quarterly profit and loss, some do monthly, some do annual. In this situation, it's probably worth doing the monthly profit and loss to have that information pretty well ready to go. I think the other thing is it's kind of hard to predict the budget. So for example, in our office, we recognized that we had a shortfall in the budget for technology. In order for us to really have good telehealth, we needed to have good communication devices. And so that was important. We are working to reconcile that. I think the other issue was the staffing for some of those practices. Our practice was certainly blessed and fortunate that we did not have people who were out for prolonged periods of time because either they were exposed and they were in quarantine, or they tested positive and they were in isolation. We didn't have the serious loss of life. I can tell you, I spent 4 days out of the practice and I sweated it because I was so afraid that we were not, that 4 days was enough to, were we going to lose revenue? And that was early on before the SBA loan came through. And so what happens with our staffing? And if we don't have enough staff to run our businesses, or what if you have a major provider? I can tell you it was also very interesting hearing of our specialty colleagues, like our cardiologists, of folks who they're doing CAFs, or surgeons, they're doing surgery, but they couldn't do this. And so how much reserve did we have? Did we truly have the 3 months of cash reserves to make sure that we could withstand it? Well, COVID's been around longer than 3 months. So should we go back and rethink what's necessary to sustain our businesses? It is not the rules of before. And so we're learning. And anybody on the line who has that business sense, I would love to hear what your thoughts are.
Thank you for that. And let's see, just a reminder, if you guys would like to come on camera or unmute yourselves, you can unmute and not have to come on camera. Take that pressure away. We did get another note in the chat from Rita Edwards. We did not file for SBA, but reminder, the second PPE is available.
And that's an option. Again, that second round is a little bit more difficult to obtain. If your practice, if you did not have a 25% loss in revenue in any of the quarters, which is the comparison quarters, then you would not qualify. However, I believe if you did not apply, that you can still go back and apply for that first distribution. I'm not 100% sure on that, so definitely check it out. And I think the nice thing about it is that they did convert that to a point where it was not a repayable, so that we did not have to take on that burden. We had an existing SBA loan for our business and capital. And so they did some payment deferments that made a difference. I can tell you that our banks in the very beginning, we were scared. We were really afraid because our banks just were not providing that additional revenue. So for us, we had to stay working. We could not shut down. And again, I think now is the time for all of us to go back and reanalyze what are our financial resources that we have available. Are they sustainable? I'll give you a life example. We had patients who we were told, families where a major breadwinner died of COVID. Well, the insurance company did not honor their insurance policy. And so there were families who were going into default. There were people who were losing their homes because they died of COVID, and COVID is a pandemic. And so who would have thought of that? We know of those businesses who had scheduled meetings, maybe a large meeting, and they had to cancel out because they could no longer do the face-to-face attendance. And so what was the penalty for cancellation? I actually had to deal with that for our family reunion. We had planned a family reunion this June, and we wanted to move the year, and I was hit with the cancellation clause. I don't know, $10,000 or a family reunion. I mean, but these are things that were happening from the business side of it, and I get it from the hotel side of it. But these were issues that were coming up that we did not have to deal with. So how do we review those contracts going forward? How do we negotiate them going forward? One thing that we didn't say, and I'm going to let Michaela talk a little bit on this, is in regard to our shared savings plans and with our insurers. And so we know that the quality measures, how do we actually accomplish meeting those quality measures for the shared savings plans when patients were afraid to get mammograms, they were afraid to get colonoscopies, or the hospitals couldn't accommodate them. Yet we had said, we're going to have a percentage completed for mammograms as part of the ACO. And maybe Michaela can chime in a little bit, and, how do we maintain those agreements?
Yeah, so in MSSP reporting, they have taken into consideration the impact that the pandemic had on completing some of those preventative things, like a mammogram, an eye exam, diabetic foot exam, anything that would require the patient to be seen by a provider to have those things completed, even, labs like microalbumin, A1C, all of those things. And so fortunately, they took that the pandemic would make an impact in getting those things completed. And so we were able to attest whether or not, that was a true concern for the patient, or, it created a barrier for the patient. And so fortunately, those organizations, specifically our ACO, has worked very closely with us. CMS seems to also have been understanding to a certain extent when it comes to trying to get some of those things completed for the patient, given that we were facing a pandemic, that a lot of people still don't feel comfortable in going to their doctors or getting out their houses. So I think that, like I said, everyone has been very understanding about the change that the pandemic has brought about. But fortunately for our patient population, like I said, because we were early adopters and changing and making significant changes in the beginning, we were able to still capture some of those preventative things for our patients and still have a significant completion rate for a lot of those preventative things. And so I think just being willing to make that change initially, like I've said, was what made us successful. But we do recognize that we could have been more successful had the pandemic not been a factor and had it not played into the anxiety and mindsets of our patients. And so that's one thing that has changed that we hope, moving forward, we can ease some of those anxieties and still emphasize that, yes, we're in the middle of a pandemic, but, you're dealing with this chronic disease that requires all this maintenance and requires these different monitoring procedures. And so that also needs to be a priority, because we don't want you, to be so fearful of COVID that you let this other thing that you've been fighting for the majority of your life get out of hand. And so we are trying to find the perfect balance. But I think that we're moving to a place where people are starting to be more understanding and more open. And like I said, our organizations have already been more understanding and more open. And so we've been able to satisfy those agreements just based off the understanding that COVID has created these different barriers.
I think one of the strategies also, we started off with the ACO, was to stay well connected through the ACO. And so they were able to actually look at our patient population and tell us who were the people that were at high risk for COVID. And that's when I saw the beauty of population health medicine. That was the beauty, because they were able to identify those individuals. And then when we open up our app, our tool that we're using, we could see who those individuals were. If I wanted to run an entire analysis and see out of our entire patient population who was at highest risk of dying from COVID if they had became infected, we could run it and then reach out to those individuals and make sure that they were following those 3 W's, wearing a mask, staying 6 feet apart, washing their hands, that they knew that they could reach out to us, we could get their medications in. And so staying well connected really, really made a difference for us. We're using the same strategy for the COVID-19 vaccination. How do we reach out to those marginalized populations, those individuals who are afraid of lining up over at the Coliseum, or who can't get out, or have difficulties and really have to make arrangements or have set times? How can we now run the data on that population and reach out to them so that they could go ahead and get vaccinated, and giving them the sense of comfort of being vaccinated? And that's what the tools have allowed us to do. And so this is what I mean, the resources that we have. One of the things that I had always learned with electronic health records as a physician, we only utilize 30% of what we have available. Now's the time for us to tap into that other 70%. It's time for us to work smarter and not work harder. And so I encourage each of you, those skills of resilience, it does work. It makes a difference. Yes, we may have anxiety, but we can actually calm the anxiety if we use those skills. And that's from the money side of it, but I think of greater for the people side of it. Know what you are attempting to do. And as I started off, seek that meaning. And for us, we wanted to make sure that we were addressing people, and all else would fall into place. And that's what it's done. Okay.
It's a really beautiful lesson there that, it does go back to the people. I will say a final, if anyone would like to come on or unmute yourself, if you have any questions for Dr. Smith or Michaela, we do welcome that. So we've got a few minutes left. I just want to, if anyone does have anything they'd like to ask, please do so. I don't see anything quite yet. Want to make sure in case anyone's having unmute issues. Well, since I am not seeing anyone wanting to come up and say anything, and it looks like our chat is still clear, I want to thank you both, Dr. Karen Smith and Michaela, for your time this afternoon, for your insights into this experience that we are still in the midst of, and just, you know, your willingness to talk about everything that you did go through, what did work, what didn't work, kind of the trials and tribulations of navigating through all of this situation, both on the human element and on the financial element. So thank you both for taking the time to join us today. We appreciate you presenting this fantastic information. We appreciate your support through the years with both of our organizations, and you continue to share invaluable information for our members and practices through all the various channels. It's great to hear that you've got a great network for yourselves as well. So thank you for that. Just as a reminder for our attendees today, we did record today's session. We will be sending out a link, so that will be available for you to get caught up on or share with others that you feel may be in need of some of this information. So thank you all again. I hope everyone has a wonderful afternoon. Dr. Smith, Michaela, thank you so much for your time and for doing all of the work that you do day in and day out.
Thank you.
Thank you for having us.
All right, everyone have a wonderful afternoon and stay safe.